My name is Jess Ting, and I'm Director of Surgery at the Mount Sinai Center for Transgender Medicine and Surgery. And as part of my surgical practice, I perform gender-affirmation surgery for patients who are transitioning male to female or female to male. For what we call bottom surgery, which is colloquial for genital surgery, we'll do a vaginoplasty. We can make a vagina and female genitalia that is remarkably lifelike. It's beautiful, it's aesthetic, and most importantly, it's functional. They can have receptive penetrative intercourse and they can have orgasms. Those are two big pluses from having a vaginoplasty. All of our patients will undergo a full checkup prior to surgery, and that involves blood tests, checking things like your blood count, whether your blood clots normally. They want to optimize their health, quit smoking if they're a smoker, optimize your weight. If a patient has pre-existing medical conditions, diabetes, or whatever, we make sure that those are optimized. If a patient doesn't have the right support, like someone to help them recover in a safe place to recover, our social workers will help ensure that those situations are optimized as well. And we'll send all of our patients for hair removal of certain parts of their genitalia prior to surgery. So our vaginoplasty patients, we do it with something called a VAC dressing, which is like a negative pressure dressings that the patient go home with upon discharge, and that stays on for a week. There's a catheter to drain the urine, and that also stays in for a week. And there are a couple of small drains that will drain any excess blood and fluid from the surgical wounds. All of those things, including the packing, which is inside the vagina, are removed at the first post-op check in a week after surgery. The most underestimated challenge of recovering from a vaginoplasty is the need to dilate. And that's something that has to be done 2 or 3 times a day for the first year after surgery. It's essentially placing these dilators in the vagina to keep the space open, keep it from forming scar tissue. And that can involve a significant amount of pain and discomfort, not to mention the time that it takes, 40 minutes a day, every day. It's very important patients come in prepared for that part of the recovery. The more common complications would be problems with healing. The incisions that we sew up can open up. We call that a wound dehiscence, and usually those just heal on their own. There can be bleeding after surgery, and the worst complications, which are thankfully very rare, are fistulas. And aesthetically, we may create something that isn't perfectly in line with what the patient wants. And so we do offer revision surgery. Sometimes it does take more than one operation to get the outcome that the patient desires or is expecting. And if a patient is thinking about surgery, it's just important that they educate themselves and become aware of all the possible outcomes, including the negative ones. One of the best parts of my job is seeing the patients after surgery. The vast majority of our patients are so happy after surgery. They come in and they feel like they're more comfortable in their bodies, and they feel like they are most authentic selves.